are you Michelle?
Yes.
Well, I'm your student nurse today. Can I get a report on your patient?
Oh, sure. We are taking care of Shannon O'Connor. She's in room 231. She is a 34-year-old female, full cold. She has diabetes type 1 for 26 years, and she have an end-stage renal disease presented today, and she's having chills and general malaise. She has a elevated blood glucose reading, and she was complaining of decreased appetite for the past few days and minimal urine output for the last month. She has a history of renal failure secondary to diabetic neuropathy and hypertensive nephrosclerosis. She has even undergoing hemodialysis 3 times a week for about a year. And her vital signs are 101.1, her blood pressure is 138/78, her heart rate is 108, her respiration is 20, OSAT is 97%. We need to check her blood glucose. She has an allergy for trimethoprim and sulfamethoxazole. She has no lesions in integumentary, no lesions. Her skin is warm and intact. Mild diaphoresis. She regular rhythm in S1 and S2 is present in her cardiovascular. Her respiratory is, her chest expansion is symmetric, and she has all clear lobes in auscultation. The GI, she has abdomen soft, round, non-tender. She has the bounce sound in all the quadrants. Musculoskeletal, she has normal range of motions in all the joints. Neurological, she's alert oriented, but she has a sensation diminished in the lower legs. For her playing is, we need to keep with the vital signs, the blood glucose checking. We need to see the dialysis, schedules for dialysis, and we're going to give her today the antibiotic. And we're going to call the doctor if the blood glucose is greater than 100 or if it's less than 100. Her last admission here in the hospital was about 3 months ago for the graft infection. Her IV is in the right hand median vein. That's all that I have.
Okay. Now, why specifically is this client receiving this medication?
Because we're suspecting that she's having an infection, so that's why we're going to give her the antibiotic.
Okay, and what action does this medication have on the body?
It will kill the gram-negative and positive and some of anaerobic bacteria side effect.
Okay. When should you question administering this medication?
For any signs of allergic reaction, or if the patient is allergic to penicillin or cephalosporin, or renal impairment, or but if we will also make sure that she went to dialysis, but I already make sure she went to dialysis. So, and I also called the pharmacist to make sure that she's okay to receive this medication.
Okay. And does this medication have a therapeutic serum level?
No.
Which vital signs should we monitor?
We should monitor all the vital signs, but we need to make sure more in the super infections, like the fever, the blood pressure,
Okay. And what physiological parameters should we monitor?
We should monitor her creatinine, her kidney functions, her signs of filtration, signs of anaphylaxis.
Okay. And what interventions must be taught to the client to ensure that the medication is safely administered in the hospital setting?
We want to make sure the client can tell us the signs and symptoms of the infiltration, if she can report it to us if she has any diarrhea or any signs of allergic reactions also.
Okay, would this be the same as at home, or is it different?
The client's probably not gonna go home with this medication because it will be an IV medication, but if she goes with an antibiotic medication, we just want to make sure she finished the whole cycle. Not like when she's feeling better, she will stop the medication.
Okay, and what side effects does this medication have?
Diarrhea, hypertension, seizures, and anaphylaxis.
Okay, and how will you know if this medication is effective?
For any decreased signs of infection, we will monitor her lab work and all the vital signs to make sure that it's getting better.
Okay, well that's all the questions I have for you.
Okay, so let's go in and give the medication for Ms. O'Connor. Hello, Ms. O'Connor. How are you today?
Good, thank you.
How was dialysis?
Always fun.
Are you having any pain today?
No.
Okay. And can you tell me your name and age, please?
Sinead O'Connor, I'm 34.
Okay. And we will check an MR. Sinead O'Connor, 34. Do you have any allergies?
Bathroom.
Okay. And we also make sure the allergy is in the system. Okay. We will check for any sign. If her skin is warm, if it's red, we will make sure she has no signs of infiltration on her. Okay, I'm gonna wash my hand again. I'm gonna put it. Do you remember the signs of infiltration that I taught you early?
Yeah, you told me to let you know if it hurts or it gets real hot or swollen.
Good, good, good. So, first we're going to give the normal saline, and we will going to check to see if it has any tears or anything, leaks or anything. We're going to check for the expiration date, for the color, it's clear, and we were going to make sure in MR if it's the right patient, the right route, the right time, the right patient, the right time, the right route. And we will document everything in the system. How we don't have the skin, I have to put it on everything. Just 1 second. Normal saline. And we're gonna check the right patient, the right time, the right drug, the right route, and the right dose. So the patient, we're gonna scan the patient's ID. A247, A247, A23, A23. And then we're gonna put the barcode for the medication. D. Okay, and we got the green light. Okay. So we are going to get the ambulance. remember that the ends are sterile, so when we take this out, we don't want to touch anything besides the bag. And we're gonna leave it hanging here for now. Oh, I'm gonna clamp, make sure it's clamped. It is clamped already, so now I'm gonna okay. Because we want to make sure we have no bubbles in the line. In here. And I'm gonna clamp for now. It is clamped already. It's good. Now we are going to make, how we don't have the IV pump, we're going to use the Diaflow.
So this week, the 14th.
We're gonna put it, it is 30 mLs. So we're gonna put it here, 30 mLs. 30 mLs. Because we're gonna flush the patients, but we're gonna wipe the side for 15 seconds before flushing. I'm sorry, Ms. Corner. And we're flushing. Are you having any discomfort?
No, it's fine.
Good, good, good. I'm gonna put it there.
So the 21st to the 22nd.
We're gonna put Diaflow. Busy day today, Okay. Make sure. Now we're gonna open again. Okay. And I'm gonna clamp. And then I'm gonna come and hook up. I'm gonna clean again. And a while prior, we will make sure we will hear her lung sounds, and we're gonna check for any edema or
If you have it before you do your then
I'm gonna unclamp.
you can do the last.
There is a 30 ml here, and then we're gonna unclamp. Okay. Now we're gonna make sure in the computer. Let me remove my gloves because it's a little wet. So I'm gonna change our gloves today. I'm gonna wash my hand.
She won't be able to answer any questions we're gonna do. But if you have any questions, you can reach out to
It's a little hard to put the gloves on. It's tight. But we're gonna make sure we're gonna put the site where is her IV, the time, and if she has any discomfort or anything, that she's not in pain or anything. We're gonna go to the antibiotic. I'm gonna scan again the patient. 8423.
Thank you.
34. Okay, and then we're gonna scan the medication. Okay, and I have the green light for the patient's antibiotic. So how we're gonna run the second line, we're gonna put it lower. And I'm gonna make sure I will clamp it before I put in the antibiotic. I'm gonna clamp the line. And also I'm gonna check for the expiration date, the right time, the right road, the right dose. Everything, the expiration to see if it's clear, the right drug for the right patient, and everything's good. And the same thing also, when we're spiking, we don't want to touch anything because it's sterile. Spike.
Did you say it out loud or your doctor gave you what kind of question? If not, then just.
Make sure, always make sure it's clean. It's clean before you do. Okay. We're gonna clean again. For 15 seconds. We're gonna unclamp. Make sure nothing is blocking and no bubbles in the line, and it is good. Okay. Make sure everything's clear. Before we leave in the room, we have to count the 5 drops. We have to count the 5 drops before leaving the room. But she's good to go. Is everything good? Are you? Is anything been? Oh, now we're going to set up for 100 mLs. Make sure everything is open. And how we don't have the IV pump. We don't have the IV pump. We are going to set up the time to come back and check it on the medication. Ms. O'Connor, I also printed the antibiotic information, and if you have like any signs of diarrhea, just let me know. And go through the papers, and if you have any question, I'll be more than welcome to answer you, okay? Is anything else that I can help you with today?
No, that's fine. Thank you.
Okay. Before you make sure it's the 5 drops of medication, and we set the time. I'm gonna document here the time the route, and if she has any discomfort or anything. And I'm gonna remove one first. Wash my hands. And I'll be right in about an hour. Come back and check it on you, okay, Miss Corner?
Thank you.
Okay.
And I do have a couple more questions for you.
Mhm.
Were there any pertinent pieces?
I'm sorry, Tracy.
Yes.
I forgot, but I will go back.
Oh, okay.
And I'm gonna make sure we put in the IV line the date, the time, and my initials.
Oh,
So
yes,
we know
okay.
when we're gonna change. I'm sorry, Miss Corner. I'm back. Now I'm gonna let you rest, okay?
Thank you.
Thank you. Okay. Gonna wash my hands again.
Okay. Were there any pertinent pieces of information that you reviewed before administering the client medication?
Yes, we will look in her creatinine, her kinases, her vital signs, and we also make sure she had the dialysis today before administering the drug. Because we called the pharmacy and we did everything to check it before.
Okay. And now, did this information affect your decision to administer the medication?
Yes, because if it was something different, we will not administer the medication. So.
Okay. Did it affect how you administered it?
No.
Okay. Well, that's all the questions I have.
Okay, I will just, I'm gonna start charting the rest, and if you wanna watch it, you're more than welcome.
Sure.